Our bodies they're basically built on this super intricate set of instructions. We're talking trillions of cells all following the same programming. But what happens when just one line of that code gets corrupted? Well, today, we're going to open up the medical notebook and really understand what's going on inside when our body's systems face some major challenges. And that question, it really cuts right to the core of our health, doesn't it? I mean, most of us, we kind of operate on autopilot day to day until a warning light suddenly flashes on the dashboard. And figuring out why that light is flashing, that's the very first step to taking back control. So let's dive right in. So today, we're going to focus on two big ones, two conditions that affect millions of people, cancer and kidney disease. Our goal here is pretty simple, really. We're going to demystify them. We'll break down what they are, what signals our bodies might send us, and, of course, how they're treated. Okay, so first up, let's tackle cancer. And to really truly get what's going on, we have to zoom way, way in. I'm talking down to the level of a single, tiny, microscopic cell. So what is cancer really at its core? Well, you can think of it as a total breakdown in communication. See, healthy cells have this built-in off switch for growth, right? But cancer cells, they just ignore that signal completely and multiply and multiply and multiply. But here's what makes it so dangerous: its ability to spread. These rogue cells can actually break away, travel through your bloodstream, and set up shop in totally different parts of your body. And that process has a name: metastasis. So, what causes this cellular rebellion? Well, it's almost never just one single thing. It's really more like a complex puzzle. You have a few different pieces that have to fit together just right. Or, I guess, just wrong. We're talking about things like your genetic makeup, environmental stuff like too much sun or exposure to certain chemicals, and of course, our lifestyle choices. They all play a part in completing that picture. Our bodies are talking to us all the time. The real challenge is that the early warning signs for something serious can be incredibly subtle. I mean, we're talking about things we might just brush off, right? Like feeling way more tired than usual for a few weeks or dropping some weight without even trying. The key takeaway here, really, is to listen to those persistent whispers from your body before they have to turn into shouts. All right, so let's say those alarm bells are ringing. What happens next? What's the action plan? Let's take a look at how modern medicine actually diagnoses the problem and, more importantly, how it fights back. Diagnosing cancer is a lot like detective work, seriously. The investigation usually kicks off with some blood tests. They're looking for clues, like specific proteins they call tumor markers, that can signal something's up. After that, imaging scans like MRIs or CT scans give doctors a map of what's going on inside. But the smoking gun, the final piece of evidence that confirms it, that comes from a biopsy, where they take a tiny piece of tissue and look at it under a microscope. Now, the modern arsenal for fighting cancer isn't just one single weapon. Oh no. It's a whole strategic combination of different approaches. You've got surgery, which is about physically removing the tumors. Then there's radiation and chemotherapy for more widespread attacks. And then you have these really fascinating, super targeted approaches, like immunotherapy. This is amazing. It actually trains your own immune system to go hunt down and destroy cancer cells. How cool is that? Okay, so let's switch gears a bit. We're going to pivot now from the body's cellular command centers to its master filtration system. And I'm talking about the kidneys. Seriously, just think of your kidneys as the most advanced, most sophisticated filter you can possibly imagine. Every single day, they filter your entire blood volume dozens of times over, pulling out all the waste to create urine. But their job doesn't stop there, not by a long shot. These small, bean-shaped organs are absolute powerhouses. They also help regulate your blood pressure and even kickstart the production of new red blood cells. So yeah, these vital organs are working for you 24/7. But what happens when they start to run into trouble? Let's dig into the signs to watch out for and the solutions for keeping our kidneys as healthy as possible. Okay, so just like we saw with cancer, there are a bunch of different risk factors for kidney disease. And hey, do you notice a pattern here? The two biggest causes, diabetes and high blood pressure, are super common conditions that lots of people deal with. It just goes to show you how interconnected everything in our body is. Taking care of one thing, like managing your blood pressure, is often the absolute key to protecting a totally different part of your body. And again, the body sends out signals when the kidneys start to struggle. It makes sense, right? If the filters aren't working efficiently, all that waste and extra fluid has to go somewhere, so it starts to build up. And that's what causes symptoms like swelling in your legs and ankles, feeling tired all the time, or noticing changes when you go to the bathroom. These aren't just little annoyances, they are direct clues about what's happening inside. The path to diagnosis here is also a pretty logical step-by-step process. It usually starts with simple blood and urine tests. They're basically measuring waste products, like something called creatinine, to see just how well the kidneys are doing their filtering job. Now, if those tests raise a red flag, the next step is often an imaging tool, like an ultrasound, which lets doctors get a direct look at the organs themselves. When it comes to treatment, there's a really wide spectrum of options. For a lot of people, it starts with lifestyle changes, diet, exercise, and medications to get those underlying causes, like high blood pressure, under control. Now, for more advanced kidney failure, we have incredible life-saving technologies like dialysis. That's where a machine literally does the kidney's job of filtering the blood. And then, of course, there's the ultimate solution, a kidney transplant. Okay, so we've looked at the problems, and we've looked at the treatments. But you know what they say? The most powerful medicine of all is often prevention. So how can we actually be proactive about this stuff? This final section is all about the simple steps you can take to build a much stronger foundation for your health. So, what's the game plan for protecting yourself? Honestly, it all comes back to the fundamentals. We're talking about a balanced diet, and that's not about being restrictive, it's about giving your cells the good stuff they need to work properly. Regular exercise, that helps keep your blood pressure and weight in check, which takes a ton of stress off your whole system. And then, of course, avoiding things we know are harmful and just staying on top of regular health screenings. These aren't secrets, They're the basic foundational pillars for good, long-term health. When you boil it all down, it really comes to this. Knowledge and action are your two most powerful tools. For both cancer and for kidney disease, being proactive with your lifestyle and really paying attention to your body's early signals, those are the two things that can make a huge, huge difference in the outcome. And that brings us to our final thought for today. Look, it's really easy to feel overwhelmed by all this information. I get it. But lasting health isn't built on some grand heroic gesture. It's built on the small, consistent daily choices we make. So I'll leave you with this question. What's one simple, healthy choice you can make for yourself, starting right now?